Hello. My name is Jones, and today we are going to look at electroconvulsive therapy. Electroconvulsive therapy, or the shock treatment, is used to treat depression in clients who do not respond to antidepressants, or those patients who have intolerable adverse reaction at administration of who have intolerable response at the administration of antidepressants. Or have adverse reaction to administered therapeutic doses of psychopharmacological drugs. Despite the controversy that is there about this therapy, which is electroconvulsive therapy, this therapy has proven to be effective for certain patients, especially those with major depression. For those with major depression, electroconvulsive therapy has been used, particularly with those with psychotic symptoms, that necessarily don't respond to the normal medications that can be administered. So ECT becomes one of the treatment of choice. So indication for electroconvulsive therapy. It is not only used for major depression, but also for the treatment of mania, that is in bipolar disorder. Then catatonia, you can use electroconvulsive therapy for catatonia. It can also be used for quick relief of self-destructive behavior. So that is for those with suicidal attempts and the likes. Electroconvulsive therapy may be indicated for the treatment of those that are severely depressed that need fast relief. So then apart from that, those with suicidal attempts or that have self-destructive behavior, so you can give. So when you say self-destructive behavior, that is those with suicidal attempts. So suicidal clients may be given ECT in order to reduce or to leave them from self-destructive behavior. So some patients may be receiving antidepressant medication, but it may take some time for the effects of these antidepressant drugs to work to reduce depression. So when you give ECT, it helps in that it gives fast action or enough time to reduce on self-destructive behavior or reduce on the depression that the patient may be having. So to do with pregnant women and electroconvulsive therapy, what I can necessarily say is that pregnant clients can also undergo an electroconvulsive therapy. The treatment does not pose harm or injury to the fetus. So if a pregnant woman is having some self-destructive behavior, electroconvulsive therapy can be provided for quick relief of depression and self-directed violence. So this will prevent harm that may come to the fetus if it remains untreated. So if a pregnant woman is not responding to the treatment, you can give ECT. So it will not harm the baby or the fetus. Some contraindications or precautions when you are administering electroconvulsive therapy is that ECT or electroconvulsive therapy stimulates a seizure episodes that occurs. However, it does not cause seizure disorder, and the patient with seizure disorder may undergo these therapies. So no absolute contraindications are noted necessarily for electroconvulsive therapy, but a few conditions have been associated with morbidity and mortality rate. So some conditions to do with contraindication of precautions can be patients with myocardial infarction. So if the patient has had recent myocardial infarction, they may have abnormal heart rhythms that may lead to death or worsen the problem. So other precautions that we need to take is for patients with a stroke. patient with severe hypertension, and patient with presence of intracerebral mass. Okay, so here you need to be cautious or take precautions when you are giving electroconvulsive therapy. But otherwise, there are no absolute contraindications that are there for electroconvulsive therapy. Let us try to understand the mechanism of action of electroconvulsive therapy. Okay, so the therapy induces a therapeutic tonic seizure. That is a seizure where the person loses consciousness and he has the convulsions. Okay, so the therapy induces a therapeutic tonic seizure which lasts for about 15 seconds. To do this, electrodes are applied to the head of the client, which will deliver an electric impulse in the brain that will cause a seizure. Okay, it is believed that the shock intensifies brain chemistry to correct the chemical imbalance in the depression or the condition that you're trying to treat at hand. So like for depression, it is going to decrease the serotonin and epinephrine, okay, so that it corrects the brain chemistry imbalance that may be existing and causing the condition. The frequency of treatment: a series of about 6 to 15 treatments are scheduled 3 times a week. Okay, so 6 treatments are needed to observe a sustained improvement of depressive symptoms. Maximum effect or benefit is achieved in 12 to 15 treatments. So a series of about 6 to 15 treatments are scheduled, that is 3 times a week. So week 1, 3 of those treatment. Another week, 3, making 6 treatment in 2 weeks. In the third week, making 12, and then 4th week. So you can treat over a month. Okay, these patients spread 3 treatment per week. Okay, so some side effects that may come with electroconvulsive therapy include confusion or disorientation. The patient can feel fatigue because of the convulsions. Then there is headache that can be felt, and then short-term memory impairment that may happen, or temporal memory loss may happen. Okay, so some nursing interventions that we can talk about in electroconvulsive therapy is that we have nursing intervention that can be done before ECT, that is before electroconvulsive therapy. You have nursing interventions that can be done during ECT, and then we have those that can be done after ECT. So before ECT, the intervention is that an informed consent should be signed. Patient needs to be new orally, that is 6 to 8 hours before the procedure, or that is before the procedures. The patient needs to be new by mouth. This is to prevent regurgitation, okay, or vomiting during the procedure. Then you can move fingernail polish if the patient has painted their nails for easy observation, and then an IV line insertion or open an IV line for administration of short-acting anesthetics, okay, and also administration of sedatives or muscle relaxants like saxonylcholine or atropine, okay, which is also given to decrease bronchial secretions, which could block airways during seizures. The other things that you can do before ECT is let the client void before the procedure to avoid incontinence. Okay, then during ECT, you can place electrodes on the client's head on one side, that is for the unilateral type of ECT, or both for the bilateral type of ECT. Then you have to monitor the brain through electroencephalogram. Okay, monitor brain activities or the electrical movement within the brain, and then oxygen administration with an army bag, because convulsion takes with it a lot of oxygen, so patients will need some oxygen. Then after ECT, when the client is awake, you can reorient the client, obtain the vital signs, assess client for return of gag reflex, which may be one of the problems that the client may face. So you can allow the client to eat with a positive gag reflex. So when you allow the client to eat and then the gag reflex has returned, then the patient would not have suffered from some complications to do with ECT. So there you have it. Today we were talking about electroconvulsive therapy or shock treatment. This is used to treat major depression, but this time it's also used for bipolar, catatonia, and quick relief for self-destructive behavior. Okay, ECT is safe to be used in pregnant women, okay, as it poses no harm. But ECT may have some precaution or contraindication for those with the myocardial infarction, stroke, severe hypertension, or have intracerebral mass or tumor. Then the mechanism of action is to help normalize the chemical balance that may come because of the mental health problem that exists, like depression. It will decrease the serotonin and the norepinephrine. So for the treatment is 3-3 for 4 weeks, okay, which will equal to about 15 treatments when you give 3-3. So 3 times 4 gives you 12. So you can treat for 3-3. Okay, so then times 5, that is for 5 weeks. Then your patient will receive the 15. But impact of whether ECT is working is felt when one has received about 6 treatments. Okay, so you see that the impact of ECT will be felt after patient has received 6 treatment. That will be in the 2 weeks, okay, of receiving the 3 per week treatments. So a series of about 6 to 15 is given. 6 treatments are needed to observe a sustained improvement, and then maximum effect is 12 to 15. So in 4 weeks or 5 weeks, you can treat with 3 in order to come up with the needed maximum effect, okay, of benefit. The side effects we talked about is confusion, fatigue, headache, and the short-term memory loss. Then the complication is lost swallowing gag reflex, which you can test by giving the patient some food and see if they are able to eat, okay, nicely, or if at all there is a positive gag reflex. So thank you very much for listening to this lesson on electroconvulsive therapy.